A pleasant day to everyone. We are the Group 4 from 1 bis and 9 and here to present our topic, the theory of interpersonal. The theory of interpersonal was published in 1953 by Henry Stack Sullivan, or also known as Harry Stack Sullivan, who stated a personality can never be isolated from the complex of interpersonal relations in which the person lives and has his being.
Henry Stack Sullivan, who also known by the name Harry Stack Sullivan, was born on February 21, 1892 in Norwich, New York, to Irish immigrant parents. His social isolation as a child may have contributed his later interest in psychiatry. After graduating from the Smyrna Union School, he spent 2 years at Cornell University, beginning in 1909. In 1917, Stock Sullivan earned his medical degree from the Chicago College of Medicine and Surgery. Between 1925 and 1929, Stock Sullivan worked at the Shepherd Pratt Hospital treating schizophrenic patients with treatments considered experimental. He was the founder of the William Allenson White Institute as well as the Journal of Psychiatry in 1937. From 1936 until 1947, he was the head of the Washington School of Psychiatry in Washington, District of Columbia. In 1940, he and the colleague Winifred Hoverhauser formulated guidelines used by the United States military for the psychological screenings of inductees.
Doc Sullivan's writings include the Interpersonal Theory of Psychiatry, 1953, Conceptions of Modern Psychiatry, 1947 to 1966, Schizophrenia as a Human Process, Norton Library, 1962, and Personal Pathology, 1933 to 1972. Some of Harry Stock Sullivan's other works are The Psychiatric Interview, Norton Library, International Behavioral and Social Sciences Library, The Interpersonal Theory of Psychiatry, International Behavioral and Social Sciences, Classics from the Tavistock Press, Clinical Studies in Psychiatry, Norton Library, Personal Psychopathology, Early Formulations, the collected works of Harry Stock Sullivan, MD, The Psychiatric Interview.
Henry Stack Sullivan, who is considered the father of interpersonal psychiatry, developed the interpersonal theory of nursing. This theory explained the role of interpersonal relationships and social experiences in regards to the shaping of personalities, as well as the importance of life events to psychopathology. Stack Sullivan's theory states that the purpose of behavior is for the patient to have his or her needs met through interpersonal interactions, as well as decrease or avoid anxiety.
The concept of personality views personality and energy system. We have two types of concept, tension and energy transformation. Tension is a potentiality for action that may be or may not be experienced in awareness, while energy transformation transform tension into either covert or overt behaviors and are aimed at satisfying needs and reducing anxiety. Sullivan recognized two types of tensions, needs and anxiety. Needs are conjunctive in that they facilitate interpersonal development, while anxiety is disjunctive in that it interferes with the satisfactions of needs and is the primary obstacles to establishing healthy interpersonal relationships.
In Sullivan's dynamism, a term that means about the same as traits or habit patterns. First is malevolence, is the disjunctive dynamism of evil and hatred, characterized by the feeling of living among one's enemies. Second is intimacy, grows out of the earlier need for tenderness but more specific and involves a close interpersonal relationship between two people who are more or less of equal status. Intimacy must not be confused with sexual interest. On the other hand, lust is an isolating tendency, requiring no other person for its satisfaction. It manifests itself as autoerotic behavior even when another person is the object of one's lust. Lastly, the most complex and inclusive of all the dynamism is the self system, a consistent pattern of behaviors that maintains people's interpersonal security by protecting them from anxiety.
We have personifications of interpersonal theory. First, bad mother, good mother. The bad mother personification, in fact, grows out of the infant's experiences with the bad nipple. That is, the nipple that does not satisfy hunger needs, while the good mother personification based on a tender and cooperative behaviors of the mothering one. These two personifications, one based on the infant's perception of an anxious, malevolent mother and the other based on a calm, tender mother, combine to a form of complex personification composed of contrasting qualities projected onto the same person. Second, me personifications. During mid-infancy, a child acquires three me personifications: bad me, good me, and not me, that form the building blocks of the self personification. Each is related to the evolving conception of me or my body. The bad me personification is fashioned from experiences of punishment and disapproval that infants receive from their mothering one. The good me personification results from infants' experiences with reward and approval. Infants feel good about themselves when they perceive their mother's expressions of tenderness. Sudden severe anxiety, however, may cause an infant to form the not me personification and to either dissociate or selectively inattend experiences related to that anxiety. Eidetic personifications. Not all interpersonal relations are with real people. Some are eidetic personifications, that is, unrealistic traits or imaginary friends that many children invent in order to protect their self-esteem. Sullivan believed that these imaginary friends may be as significant to a child's development as real playmates.
Levels of cognition. Sullivan divided cognition into three levels or modes of experience: the prototasic, paratasic, and syntactic. Levels of cognition refers to ways of perceiving, imagining, and conceiving. Experiences on the prototasic level are impossible to communicate, while in the paratasic, experiences are personal, prelogical, and communicated only in distorted form. While in syntactic, cognition is meaningful interpersonal connection.
For the stages of development, Sullivan postulated seven epochs or stages of development, each crucial to the formation of human personality. The thread of interpersonal relations runs throughout the stages. Other people are indispensable to a person's development from infancy to mature adulthood. His seven stages are infancy, childhood, the juvenile era, pre-adolescence, early adolescence, late adolescence, and adulthood. The first developmental stage is infancy, from birth to the development of syntactic language, a time when an infant's primary interpersonal relationship is with a mothering one. The second developmental stage is childhood, from syntactic language to the need for playmates of equal status. The mother continues as the most important interpersonal relationship, although children of this age often have an imaginary playmate. The third stage is the juvenile era, from the need for playmates of equal status to the development of intimacy, a time when children should learn competition, compromise, and cooperation, skills that will enable them to move successfully through later stages of development. The most crucial stage of development is pre-adolescence, from intimacy with a best friend to the beginning of puberty. Mistakes made during this phase are difficult to overcome later. During early adolescence, young people are motivated by both intimacy, usually for someone of the same gender, and lust, ordinarily for a person of the opposite gender. People reach late adolescence when they are able to direct their intimacy and lust toward one other person. The successful completion of late adolescence culminates in adulthood, a stage marked by a stable love relationship.
Meta-paradigms of the interpersonal theory. The first one is person, which is a developing organism that tries to reduce anxiety caused by needs, and environment, which consists of existing forces outside of the person and put in the context of culture, and health, health, which is a word symbol that implies a forward movement of personality, and lastly, nursing, which is a significant therapeutic interpersonal process that functions cooperatively with another human process that makes health possible for individuals in community.
To sum up everything, this model of nursing provides the basis for interpersonal psychotherapy to specifically address patients with depression and schizophrenia. The theory proposes that depression most often develops in the context of adverse events, especially loss.
Once again, we are Guffor from 1bis and 9. Thank you for listening.